Hey, you guys, it has been a little bit since we've done a dental implant check-in, so I wanted to go ahead and do that today. I had my official post-op appointment with Dr. Dalla. He took a look, they took some pictures, everything looks like it's healing really well. I do still have a lot of stitches, but I got the all clear to go back to soft solids because I'd been doing only liquids, just what I could drink, like very, very thin liquids. So he did give me the all clear to go back to soft solids, which is super exciting. I've been able to do some sweet potatoes with some scrambled eggs, and I did some mashed cauliflower one day. So that has been very nice to be able to add in. I'm still predominantly doing liquids just because I'm super nervous. I really worry that the soft tissue infection that I got, because they weren't really sure what caused it, he said it could have been like a food particle or something that got caught in my gums. And since I can't use a water pick in the surgical area right now, I'm just super nervous about putting things in my mouth that could get caught there that I can't just rinse out by doing a saltwater rinse. So because of that fear, I've still predominantly been doing just protein shakes, and honestly, m- pretty much all just pre-made, because even the ones that you mix at home when it's a powder, I don't know, I'm just worried that a tiny little granular of protein powder could get lodged between the implants and the gums and cause a whole nother problem. And I just want to be, it's an abundance of caution, I know, but that's my choice. Like, this is a huge investment of not just money, but my time and my health, and I want to make sure that I'm taking every precaution to have the best possible outcome for myself. I cannot put all of the responsibility of this being successful and going well on Aura 4X or Dr. Dalla. Like, a lot of this is me. I'm the one at home taking care of my teeth day to day, taking care of my oral health day to day. So again, I just want to do everything I can to give myself the best possible outcome. And that's my personal choice. I know that I'm being a lot more restrictive with myself than a lot of people, but that's okay. That is my choice. It is what I'm choosing to do. But the healing is going well. Everything looks good. It's much more filled in. I don't have that giant divot on my gums that I did before. It still needs time to heal and then for the tissue to like mature and fill in from the bone graft and the skin graft. So that's going to take some time. I go back in about another 3 weeks towards the end of July now. Um, and then he thinks it'll probably take a good 2 to 3 months before everything's fully healed and we can start looking at, okay, what's next? You know, are we good to go ahead and move forward with final scans and my final implants, which is super exciting. So, you know, I started this journey in March. It is now April. It is now July. Gosh, I don't even know what month it is. But so yeah, we're in July. Everything's going well. It's moving forward. I cannot wait for all these stitches to start dissolving. They said it would take about 4 weeks. Surgery was June 25th. So I'm thinking that the stitches should start dissolving and coming out. I have stitches across, you know, the roof of my mouth where they did the bone and tissue graft donor site. I have stitches in my gums in the front, underneath, and in the back that I can feel. I'm not messing with them. I'm keeping my fingers out of my mouth completely. I'm keeping my tongue away from them. But sometimes, like when I go on my daily walks, and I don't know, I can feel them. I don't know how to describe it, but I can feel them. So I'm just trying to leave everything alone, let everything heal. Again, give everything just the best possible chance at healing, doing a ton of saltwater rinses. I brush my teeth every morning and then I go on my walk. As soon as I get home from my walk, I do a saltwater rinse. Throughout the day, anytime I drink anything or eat anything other than just plain water, I do a saltwater rinse as soon as I'm done. And then at the end of the night, I brush and then I do the water pick just on the bottom. I avoid the top completely. And then when I brush, I stay away from the gums too. I just brush, I do brush along the bottom, my tongue, my cheeks, all that, but on the top, I just do the teeth. I completely avoid the gums, both front and back, because I just, again, out of an abundance of caution, I'm not wanting to damage anything. I'm not wanting to irritate anything. I just want everything to calm down and heal. I think what I'll do is I'll try to attach in this video like a progression of, because I was taking pictures every day of the healing. I did not lift up my gums or do the inside of my mouth because again, leaving things alone and trying to heal, but of the outside of my face, of the swelling and the bruising, I was taking photos every day there for a while. So I will go ahead and do like a progression of the day to day over the first 3 weeks after my bone graft and tissue graft and 1 implant removal for the revision surgery from the soft tissue damage. I'll go ahead and put that in here for you guys to watch. If you have any questions, feel free to drop a comment. Otherwise, as always, I appreciate you watching, following me along with my journey. I'm hoping that this information is helpful for somebody out there. If you've gone through this and have an experience, again, let me know what it's been like for you. I'm really enjoying building up a community of other people who've gone through similar surgeries with dental implants. So thank you guys for watching. Have a great day.